I'm Sunny with the Be Kind crew, and I want to welcome you to Connect2STEM TV. Organized by the University of Arizona College of Medicine, Phoenix, in partnership with Cox Communications and the Arizona SciTech Festival. Who's ready to get nerdy? Today, we are going to have fun and work on a STEM project. Be sure to have your materials. Get ready, set, let's go.
Hey everyone, my name is Lacey, and today we are getting together to talk about the lungs, one of the most important organs helping us to stay alive, in addition to our hearts and our brains, that is. I'm sure all of you have learned about the lungs at school. When we breathe in, lungs are the organs where the air goes. When we breathe out, it's the lungs that push the air out. Of course, the process is a bit more complicated than this, but that's the basic idea. You all probably know that we have two lungs, but how many of you know that one of our lungs is actually smaller than the other? Can you guess which lung is smaller? That's right, the left lung is smaller. It only has 2 sections or lobes, where the right lung has 3 sections or lobes. Why do you think your left lung is smaller than your right lung? Good guesses. Your left lung only has 2 sections, so it can make room for your heart, another really important organ for helping us stay alive. So, what are the lungs? Well, the lungs are a sponge-like organ inside of your ribcage. Your ribcage protects your lungs and is made up of hard materials like bones and cartilage. And you have not 1, not 2, but 12 pairs of ribs. The ribs are great at protecting not only your lungs, but also your heart. So, the lungs are located inside the ribs. But how is it that your lungs move so that you can breathe? There is a structure right under the ribs called the diaphragm. This is a muscle that helps you breathe in or inhale, or breathe out and exhale. Let's take a look at the important role your lungs have in what is called the respiratory system.
The respiratory system extracts oxygen from the air, a gas our cells need to live and grow. The respiratory system also eliminates carbon dioxide that cells produce after using oxygen. This process is known as respiration. Respiration is an automatic, involuntary process. Air comes in through your nose and encounters little hairs that moisten it, heat it, and clean it to keep dirt out of your lungs. The air continues down the pharynx, the larynx, and then the trachea. The trachea, or windpipe, splits into 2 to make the bronchus inside the lungs. Once the air is inside the lungs, it goes through pathways called bronchioles. Your lungs are the most important organs in respiration. They take the oxygen from the air and expel the carbon dioxide that your body doesn't need. The alveolar sacs take that oxygen and send it to the blood to distribute through all the organs and cells of our body. The diaphragm located under your lungs helps fill the lungs with air. Inhale. It also expels the air your body doesn't need. Exhale. The air we exhale contains carbon dioxide and waste, and it is hot. You can feel the heat if you put your hand over your mouth when you breathe out. Smoking and pollution can harm your respiratory system. Exercise and breathing clean air are really important to take good care of it.
So as you saw, our lungs are so important to us that even a little problem with our lungs can make it very hard to breathe. Sadly, Sometimes because of illnesses like asthma or COPD, our lungs don't work properly. Also, one thing that can really hurt your lungs is smoking. This image depicts a healthy lung on the left and a smoker's lung on the right. Now, I know that none of you smoke, thank goodness, but there is one lung disease called asthma that many adults and children have. In fact, some estimates indicate that about 1 in 10 children in the United States have asthma. Asthma is so common that on the first Tuesday of May, World Asthma Day is observed. World Asthma Day started 23 years ago in 1998 as a way to make more people aware about asthma. Asthma does make breathing difficult for millions of Americans, and there is no cure. The good news is that asthma can usually be managed and treated. So, what about asthma makes it so hard to breathe? Let's take a look at what happens to us during an asthma attack.
When you're not having asthma symptoms, your airways are clear. Air can easily flow in and out of your lungs. When an asthma attack begins, the smooth muscles around the outside of the tubes may tighten. The airways, or bronchial tubes in the lungs, become inflamed and swollen. This makes it difficult for air to pass through the opening. The mucous membrane lining in the tubes begins to produce thick mucus, which builds up and further blocks the airways. This tightened airway may result in a wheezing sound and shortness of breath, signs and symptoms of an asthma attack.
All right, now that you've seen how asthma works, we as pharmacists play a very important role in educating the public and our patients. For example, in a hospital, a mother of a 10-year-old child has just learned that her son has been diagnosed with asthma. She has never heard of this disease and is worried she won't understand the complex nature of how an inhaler works. Now, what do you think is going to happen? Good guesses. So, the doctor explains that breathing problems can be solved by using an inhaler. He also tells the mother that asthma is a breathing problem that can stay for a very long time. It's usually lifelong. It has symptoms like chest tightening, coughing, and wheezing. You can always tell if a person is wheezing if you see them trying to breathe, but every breath in and out, you hear loud sounds like this. That's kind of what wheezing sounds like. However, asthma can be managed. Today, there are many devices and medicines in the market that help manage the symptoms. Pharmacists, doctors, and healthcare professionals work very hard to help people with asthma. One device that is often used for people with asthma is an inhaler. An inhaler is a small device that can fit in your hand, and when it is put to the mouth and pressed on, it will release medicine that helps the patient breathe better. When someone is prescribed an inhaler, usually in a clinic or a hospital, a doctor or perhaps a pharmacist teaches the patient or their caregiver, for example, the parents of the small child, the proper way to use an inhaler. Now, why is this important? Why does it matter if someone knows how to use their inhalers properly or not? It matters because the medicine will only work if it can reach the lungs. So pressing the inhaler must be in rhythm with breathing in. This means that when you press on the inhaler and breathe in the medication, only then will it reach the lungs, because that is where the air goes when we breathe in. What happens then? The medicine will act on the small muscles present in the lungs. In case of an asthma attack, these muscles make a strong grip on the lungs, like they're squeezing them. When the medicine reaches these muscles, it makes the lungs lose their grip and unsqueezes them. Now the person can breathe much better. Any questions about how an inhaler works? First, let's take a closer look.
Some medicine comes in a pill form and some comes in an inhaler.
Oh, I so know what one of those looks like. There's a big rectangle up here and a little thingy with a hole down here and then some other stuff.
Yeah, and some other stuff. This part is a small bottle, and it's where the medicine goes. The bottle fits into the holder, which is the part that goes into your mouth.
Explain how you make it work.
Squeeze the medicine bottle down into the holder, push here and here.
Oh, let me do this part. Mist shoots out of this part and into your mouth. Coolest thing ever.
I agree. It's cool, especially when you know how to use it the right way.
What? Stick it in your mouth and push down, right?
Well, then the medicine would end up in your mouth and not in your lungs. It needs to go to your lungs.
Is that a girl or a boy? It needs better hair.
Anyhow, it's very important to breathe in and squeeze your inhaler at the same time so that it gets all the way into your body.
Like here and here and here. What about this plastic tube thingy, like my friend's doctor gave him to use with his inhaler?
Yeah, that's called a spacer. There are different types, but many look kind of like this. It can help make sure the medicine actually gets down into your lungs where it's needed. So if your doctor recommends one, it's a really good idea to use it. And because this inhaler is so important if you have an asthma attack, you should make sure that you carry it with you wherever you go.
You could put it in your pocket or wear it as a necklace. You could have two and make super earrings or put some in your hair.
Just don't forget it. And stop doing that to my picture.
Okay.
So, as you can see, inhalers are one device used to help people with asthma and other conditions that harm the lungs. But there are many different types of devices and medications healthcare professionals can use to help you breathe better. Now, in the past year, there's been a very dangerous virus that has been hurting many people and often attacks the lungs. Let's view how COVID-19 affects the lungs.
When you breathe, air flows in through your mouth and nose and down your airways. Inside your lungs, the airways end in clusters of air-filled sacs. These air sacs are surrounded by tiny blood vessels. Here, oxygen from your lungs passes into your bloodstream to get to tissues throughout your body. Carbon dioxide is breathed out. COVID-19 is a disease caused by a virus called SARS-CoV-2. The virus infects cells along your airways by attaching to ACE2 and other molecules on those cells. The virus uses ACE2 as a door to get inside of the cells and make more copies of itself. The virus, and your immune system's reaction to it, inflammation, damages the air sacs, causing them to scar and stiffen or fill with fluid. This blocks some oxygen from passing from your lungs into your bloodstream. As blood oxygen levels fall, you may feel short of breath. In severe cases, a ventilator or other support may be needed. Inflammation helps our bodies fight infection, but in some people with COVID-19, it seems to go into overdrive. Researchers think this may be due to the fact that the virus latches on to the ACE2 molecule in order to get into cells. ACE2 helps reduce inflammation, and this effect is lost when the virus occupies it. The result is that inflammation can go awry. NHLBI-funded research over decades has helped us understand ACE2, its role in inflammation, and how it is hijacked by the virus. NHLBI is also supporting new studies, including clinical trials, focused on developing safe and effective treatments for people infected with SARS-CoV-2. People with chronic lung, heart, or blood diseases may be at higher risk of severe illness from COVID-19. We should all take steps to help protect ourselves and others from infection by washing hands often, avoiding crowded places, wearing a mask, and staying at least 6 feet away from other people. Visit our website for the latest information and resources on COVID-19.
So as you can see, COVID-19 can be dangerous. Although many things about COVID are not understood, scientists all around the world are studying the disease. We do know, however, that prevention is the best approach to not getting sick. So remember to wear your mask, maintain social distancing, and practice hand hygiene. Now we're on to our next presenter to show you the lung activity.
That is great. And now make sure if you have questions, such great information that we shared there, put your questions in the chat function. And now I'm going to turn it over to students and faculty from the College of Pharmacy. Take it away.
I'm on mute.
There you go.
Hi, my name is Jesse. I'm going to be showing you how to make a lung model. If you can see that. So with this model, it's just going to show you how we breathe in through our nose and it goes down into the brachies and separates into the bronchi, and then the bags here represent your lungs. So you're going to need 2 sandwich bags, 2 straws, and scissors, as well as tape. So first, we'll put the 2 straws together and then tape it together. Then we'll separate the ends down here, the bendy ends. We'll set that down. We'll want to open up the bags first and then cut the green part off. We'll do that for the second bag. So we'll open up the bags. And now we'll try to attach it to our straws. This part's kind of hard. It did take me a few tries when I first made it. But you just want to bunch the open end together. And then we'll just use a lot of tape to make sure no air gets out. All right, so that's 1. We'll do the same thing for the other lung. There. Okay, and that's that. And you just blow in. They're inflated. And now this is breathing in. And so when you breathe out, you just gotta squeeze the bags. I think it works better with this one. So yeah, so it's just, you breathe in through your nose, goes down into the bronchs, which separate into the individual lungs. and that is respiration. Any questions?
That's great. I see you have a question. It says, what happens if you breathe through your mouth instead of your nose?
The air is still going to go into your lungs. It's just less efficient. And then if you cover up one of the straws, that will show you how it is to like breathe with congestion. So if we cover up just one, only the left lung got filled and this one's still empty.
That's great. And then we will be sure to send instructions in the post email so that for everybody attending, if they'd like to do this at home, they'll have the instructions to make their own lungs. Okay. What else can you tell us about the lungs? There was a lot of information that was on the video, and it talked about COVID. It talked about keeping our lungs healthy. So what are some things that we can do right now to keep our lungs healthy?
So hi guys, I'm Shreya. I am a third-year pharmacy student, and I'm helping with this event. So other things that we can do to keep our lungs healthy is that we can practice exercising. So walking around, moving your body, getting your lungs to move faster at times and then slower when you're resting helps keep those muscles exercised to help the efficiency of our lungs. It also helps when you do breathing exercises to calm yourself down and getting more oxygen to your brain instead of holding in your breath at times, and just sort of relaxing our body to help overall to strengthen your lung muscles.
That's great. You talked about exercising in your lungs. So how much exercise each day should we really be getting to keep our lungs and our bodies healthy?
So we should be getting at least 30 minutes of exercise a day, if not more. And that can be in any form, such as walking, jump roping, skipping, also going for a run if you're into running, doing any sort of exercise to get your body moving and that blood flowing through your body.
That's great. So you all are representing the University of Arizona College of Pharmacy. So would you also like to ask a question of, tell us a little bit about why you want to be a pharmacist?
So I can go first. So like I said, I'm a third-year pharmacy student, and I had decided I wanted to do pharmacy while I was in high school. It was something that really sparked my interest. I did think about doing medicine. I knew I wanted to do something within medicine, but I am very squeamish when it comes to blood and guts. I can't handle that. So the other side of that is actually practicing medicine and dealing with medications. I also think that I got into going into pharmacy by volunteering. I did some volunteering at a pharmacy. I also shadowed some pharmacists while I was in high school and through my college. I actually have a bachelor's in nutrition, so I had a bit of a food lifestyle before I started pharmacy school, but food and health play a huge aspect into trying to make sure keeping our bodies healthy and safe, and so that hopefully you don't need medications. But in the case that you do need medications, you know, we're also there to help you as pharmacists.
So I got into pharmacy mostly because of my family. I have an uncle who's a pharmacist, and one of my close cousins, he's a pharmacist as well. I really didn't know what I wanted to do while I was in college. So my cousin recommended that I get a job as a pharmacy tech and, you know, to see if I liked it. So I did that, and I was a pharmacy tech for 4 years, and it's a fun job. I love helping people, and I just decided, yeah, this is what I want to be. I can see myself as a pharmacist, and so I pursued that, and yeah, here I am at the U of A College of Pharmacy.
Hi there, I'm Wendy, and I am a pharmacy student at the Phoenix campus. The University of Arizona College of Pharmacy actually has a small portion of our students on the Phoenix side, and so I was inspired to come to pharmacy, to come back to school, because of all the exciting medications and drug therapies that come out. New and unique ways to help people. We're learning so much about the human body and about how to make medications that will help people, just like the asthma patients we were talking about. So that's what brought me to pharmacy.
Hi, I am Jewell. I'm also at the Phoenix location for the University of Arizona. I know that you guys just learned about animals before this presentation, and that's actually what got me into pharmacy. I wanted to be a vet before and started working at a vet clinic, and when I was there, I realized that I was much more interested in the medication being given to the animals versus the rest of the veterinarian activities, and I changed my degree and decided to go to be a pharmacist.
Okay. Anybody else like to share? All right. Any more questions for our team here? Well, thank you all so much for joining us. We also want to say a special congratulations to Palivi, who has won our Connect2STEM t-shirt for this session. So congratulations. We invite you to stay tuned. Coming up in just a few minutes at 11:30, we are going to go inside the artificial tissue lab. So stay tuned for that, pique your interest. Coming up after that at noon, we're going to be touring the Palo Verde generating station. And then at 1, we're going to be doing art in geometry. So there's still a lot more ahead on Connect2STEM TV Live. And now a quick message from our Be Kind crew.
Learning about STEM is fun. Be sure to check back for more Connect2STEM TV. There's lots more to do. Don't forget you need to register here. Special thanks to our sponsors, Banner Health, APS for their great support. And be sure to follow Connect2STEM on Facebook.
Right, we'll see you in just a few minutes. Thank you all.